You probably do.
All right, I'd like to thank everyone for coming today. We are here to talk about the introduction of the Jacki Rickert Medical Marijuana Act. It's a bill that we brought together patients, community organizations, and lawmakers together, united in support of giving patients who are suffering in pain access to a medical options that they are no longer be forced to forego something that can make their life more bearable. This issue is first and foremost about compassion, and it's also about health care reform. A patient and their doctor should have as many options as possible available when treating a patient's medical condition. Medical marijuana is currently legal in 13 states, and if you look at the little graphic there, the dark green states, there are also 17 states that have some other form of medical marijuana legislation, whether it be access to research or some other form of legislation. This is an issue that I think the public is way ahead of lawmakers, at least in the past decade where we've seen this bill not get its full attention in the legislature, and we are hoping to see that change this legislative session. I am joined by the Senate lead author, Senator John Erpenbach, who in just 1 second will describe the bill, as well as Jacki Rickert, for whom the bill is named after, a medical marijuana patient who made headlines 12 years ago by leading a 210-mile trek from Mondovi to Madison in her wheelchair, along with Gary Stork, who has been instrumental in advocating for this legislation in the past. So we will start with Senator John Erpenbach describing the bill as proposed.
Thank you, Mark. Just real briefly, my history with Gary goes back. I was elected in '98, so my first year was 1999 in the state senate. My very first town hall meeting, very first one, that's what politicians do, we do town hall meetings. I went to the north side of Madison. First question I get is from Gary, when are you going to legalize marijuana for medical purposes? It's like, I'm this new kid, it's the first time I've ever heard about this, so we go backwards. And I'm here today supporting this simply because Gary has pushed and he's right. There should have been law a long time ago. And the way the bill works is actually really pretty simple. If you qualify with a debilitating disease, we're talking AIDS, MS, a number of them, as well as others that will be added to the list from the Department of Health and Family Services when they sit down and go over this in the rulemaking process. What you'll need is a note from the doctor saying that you qualify for the use of medical marijuana. And then you'll get a card from DHS. Your name goes on a registry. And what happens from that point on is basically you can use marijuana for medical purposes, and medical purposes only. You can't drive, you can't operate heavy machinery, you can't drive a bus, you can't smoke in schools, you can't smoke in public. You can also, it's not just smoking too, by the way, you can cook it, you can get a vaporizer. There's many different ways to use marijuana for medical purposes. But as Mark mentioned, we are an extremely compassionate state, and this is what this is really truly all about. Most of us in the state don't have MS. Most of us in the state do not have cancer. Most of us in this state don't go through the kind of chemotherapy treatments that cancer patients go through. At the same time, what's being prescribed by the doctors to manage pain and make life more comfortable for those suffering with these diseases is extremely harsh on the system, extremely harsh. So medical marijuana for some people is the best way that they can find any sort of relief, the best way they can create an appetite, and the best way they can keep some food down. So it really is a pretty simple bill. We are having I'm supposed to say a combined hearing, not a joint hearing, but a combined hearing coming up on December 15th with both health committees from the Senate and the Assembly. And it is my goal to get this through the Senate Health Committee and hopefully we get it up for a vote on the floor and get it passed the Senate sometime when we get back in January.
Thank you, Senator. And also, I just want to share, one personal quest in dealing with this issue over the last decade. I was on a statewide public radio one time, and it was interesting. Someone called from western Wisconsin, and his wife was going through chemo and had cancer. And they were sending out their high school son to go and get marijuana so that she could feel better and not have the nausea, and she could have an appetite while she's undergoing chemotherapy. And it was really telling that they were going through the angst of sending their child out to break the law so that the mother could actually feel well. And when you talk to patients, and we have a lot of patients right here today that you're more than welcome to talk to afterwards, to find out just why so specifically this is helpful in how they lay out their care, it's really very compelling that why we need to be another state in the nation that does this. And there's a number of reasons why we feel very optimistic. As Senator Erpenbach said, we're going to have a combined hearing coming up December 15th. with both the Public Health Committee in the Assembly as well as the committee in the Senate. And we're very hopeful that we'll get a good public hearing and hopefully good votes out of the committees on that. The President himself announced not too long ago a hands-off policy on state medical marijuana programs. And I think that's a real new sign from the federal government that they're looking at this very seriously as part of health care and as just that, as part of health care. I think also the American Medical Association last week announced that they were talking about they want to research the medical potential of cannabis and relax anti-marijuana laws for clinical study, which is what a lot of those lighter green states already have in place, but because the federal government has a monopoly on access to marijuana, we haven't been able to really study it as extensively. So the American Medical Association also is out there on this. We now see 13 states have passed these laws, and there's been progress in other neighboring states. So Michigan passed it by referendum. 63% of the people said that they wanted this to be the law of the land. And in Minnesota, the legislature passed the bill in both houses, got to the governor, and Governor Pawlenty actually vetoed the bill. But literally, other neighboring states have done significant movement or passed a bill with support from the public on that. We've also found that Governor Jim Doyle has recently said that he would sign the bill into law as long as there's a doctor's prescription. And we see positive sign from the governor that this bill has a chance to become a reality. So the fact that we now have a strong Senate lead sponsor, Senator Urkenbach, the fact that we're joined by groups here today, including HOPE, which is the organization of hospices in the state, the ACLU, and the Epilepsy Foundation, 3 groups that have publicly already come out in support of the bill, and numerous patients. We certainly are seeing a different landscape than we have in past years. And while we feel this bill has got real strong potential to pass this session. But I think the most important dialogue we can have on this are from people who have been on the ground level dealing with this on a regular basis. And I would like to first introduce Jacki Rickert, who is the person that this bill is named after, who has been a strong advocate over the years on behalf of medical marijuana, and also Gary Stork, who is Madison-based. Jacki's from Mondovi, who has also been a strong advocate over the years. And I think Jacki's going to start, and Gary will follow.